a patient brings a child in, how do you diagnose leukemia?
Well, the first suspicion is you do a blood count. And the blood count may show signs of anemia, which is a loss of red blood cells, or low platelets, which are parts of your blood system that prevents bleeding, or your white count may be too low, or your white count may be too high. So in combination with signs and symptoms, your doctor may feel that it's warranted to go see a specialist, a hematologist. To make a diagnosis of leukemia, we need to do a simple test, which we do under sedation, under anesthesia, called a bone marrow aspirate and biopsy, where we take a syringe and remove about a tablespoon of blood from the hip bone, and then send that off to the laboratory for analysis under the microscope and through some other tests. So the diagnosis of leukemia, which is a cancer of the bone marrow cells, is done through a bone marrow aspirate. The bone marrow, for those of you that eat chicken, look at chicken bones, that's the middle part of the bone. And that's located basically in people's hips and legs and ribs and spine, and that's where blood cells are produced.
I also wanted to ask you, and again, is there a difference between adults and children as far as leukemia?
There is. There are acute leukemias and there are chronic leukemias. In adults, chronic leukemia is far more common. In children, we rarely see chronic leukemia. Besides dividing the leukemia into acute and chronic, as I said at the onset, there is ALL, acute lymphoblastic leukemia, and acute myeloid leukemia. Children get acute lymphoblastic leukemia. Adults get acute myeloid leukemia, so there's complete reversal. And even when you look at the same type of blood leukemia in a child, in adult, there's frequently subtle differences between the two. For us, fortunately, most of our children do get better with chemotherapy, whereas the prognosis for adults with acute lymphoblastic leukemia is not as good. And for adults with acute myeloid leukemia, especially for the elderly, which unfortunately is getting close to my age now, around age 60 and greater, the prognosis is poorer than for a child diagnosed with acute myeloid leukemia. So there are biological and what we call prognostic differences between adult leukemia and childhood leukemia.
So we can kind of move along here because we're running a little, behind time. Let's start talking about some lymphoma. The different types of, common types of lymphoma in children. Maybe you can just discuss some of those to the audience.
Childhood lymphoma, again, is different from adult lymphoma. Adult lymphoma is very complicated with both chronic and acute types, or indolent or aggressive. In childhood and adolescence, we see, well, first of all, there are two broad areas of lymphomas. The majority of lymphomas in children and adolescents are non-Hodgkin lymphoma. That's about 60% of the cases. About 40% of children and adolescents have Hodgkin disease. That ratio is a little bit different in adolescents who have a higher frequency of Hodgkin disease. Now, if you broke down non-Hodgkin lymphoma, there are basically four types of lymphoma. There is something called Burkitt lymphoma, named after Dr. Dennis Burkitt, and that's about almost 40% of the cases. Then there's something called lymphoblastic lymphoma, which looks a lot like leukemia. And then there's something called diffuse large B-cell lymphoma, which adults get more commonly. And then there's anaplastic large cell lymphoma. So there's basically four types of lymphomas that we see in children, as opposed to perhaps maybe almost a dozen different types of lymphomas that adults can have.
And what are the signs and symptoms that you see when children
again, they're pretty subtle, but more frequently than not, whether a child has Hodgkin's disease or non-Hodgkin's, you have painless enlargement of your lymph nodes, mostly in your neck or around the collarbone. And these are not simple lymph nodes that flare up when a child has a bad cold, but these are, again, non-tender. That is, you can touch them and the child doesn't recoil. They're larger than typical, about the size of a grape or larger. They feel firm, rubbery. So that's among the most common presentations, is an enlarged lymph node that's not painful, that doesn't go away. Other situations, especially in the case of lymphoblastic lymphoma or Hodgkin disease, when the disease arises in the chest area, is that a child could have a chronic cough or shortness of breath. A cough that doesn't seem to be related to a cold, a cough that persists, a cough that a doctor doesn't think is asthma. So those are the more common types of presentation for a child or teenager with lymphoma.
Okay. What do you see as far as, what's the difference, or let me ask you this, what's the difference in the treatment and the outcome overall for children with lymphoma as opposed to children with leukemia? And if you can just, briefly say some of the treatments, what do you use as far as those?
Often the drugs are the same. We use different combinations of drugs. Sometimes the drugs may be 4, or in other cases about a half a dozen to a dozen drugs. You asked what's the difference in outcome for lymphoma versus leukemia. On the whole, lymphoma is curable. Whether it's localized or even if it's advanced, the cure rates are in excess of 90%. Some cases when you have advanced disease, the rate is below 90%. The probability of a child being diagnosed with acute lymphoblastic leukemia being cured of his or her disease has gotten impressive, where if you have some good features, the cure rate is in excess of 90%. Wow. Overall, about 80%. The drugs are tailored. It depends upon the type of leukemia or the type of lymphoma. Some lymphomas require a couple cycles to about 4 cycles of chemotherapy given basically every 21 days. In the case of lymphoblastic lymphoma, which is more like leukemia, the treatment is for 2 years. Treatment for leukemia is between 2 to 3 years. Difference between lymphoma and leukemia, you didn't ask, but just for, is that lymphoma is a cancer of lymphocytes and typically arises in the lymph node as opposed to the bone marrow. Leukemia arises in the bone marrow. So that's a difference.
Yeah. Okay.
A little subtle.
Yeah. It's still blood cancer, but it's in different areas of the body. So.
But as Scott mentioned at the onset, one of the keys to overcoming cancer is accurate diagnosis. Right. To know specifically what type of disease your child or teenager has, doing all the molecular and pathologic studies, and then identifying what type, and then matching the drug combination that we think works best, we know works best, right, with that particular type.
And again, early diagnosis too always is a factor in there too. So let me, and again, because people don't think about this when they have young people who have cancer, leukemia, lymphoma, but the side effects and the long-term effects, fertility, etc. What can you kind of say? Because I know some people may do special things for future, and maybe you can kind of explain some of that long-term effects on it.
Because the majority, in some cases almost all kids diagnosed with these types of hematologic malignancies will be cured, more and more interest and attention is being spent to reducing the toxicity. We're going away from radiation in lymphomas and leukemias so as to avoid the side effects. So what is becoming more and more of a interest to the field, because more and more kids are surviving, being cured of their cancer, is what you said, late effects. And the late effects could be things like obesity, it could be thinning of the bones, osteoporosis, it could be cataracts. You mentioned at the beginning about the use of prednisone and moon phases. One of the side effects of prednisone is the development of cataracts, cloudiness in your eyes. There are other more serious things. We're concerned about heart disease, and so we limit some of the drug dosages so as to avoid cardiac problems. And then one of the more feared complications is that you've survived one cancer and then you come down with another cancer, which is a result of the drugs that we were giving to cure you of that. And you also mentioned about fertility. And a lot of that depends upon the age of the child, whether the child is closer to puberty, where there's a greater risk, as opposed to a small child who's pre-pubertal, where the ovaries and testes are more protected from the damages of chemotherapy. And for those that are around the teenage years, there's sperm banking available for that.
Okay. And the emotional health on the children, parents, maybe you can just explain briefly about that, and maybe some general advice to parents of a child with leukemia or lymphoma.
It's tough. And the kids do very well, as Scott was talking about, that they are really models for us.
Yes.
They are resilient.
Yes.
But when cancer strikes the child, it also strikes the rest of the family.
Right.
And that's why it's important for psychologists to deal with anxieties on the parents' part, anxieties that the brothers and sisters might have. So when you treat the child, you actually have to treat the family and to anticipate issues. And for the most part, our kids and our families do quite well. They're a testament to resilience and courage.
Okay. Well, I want to thank you, Dr. Corey, for coming and talking to Battling and Beating Cancer today. You were a great help to a lot of people out there, but thank you so much.
Thank you very much.
Thank you. And I want to also just thank our MBT, our Meckler, Bulger, and Tilser, Merrick, Pearson. Thanks. Our thanks to Dr. Corey to coming to our program today, and our executive producers, Dorothy and Christy. And next Wednesday at 7:30 on Battling and Beating Cancer on CAN TV 21, we will be joined by Dr. Vino Gopal, and we will discuss leukemia signs, symptoms, and treatments. And I wanted to welcome you back, Scott, and tell you look great tonight.
I always do when I'm on the sidelines. You guys have to admit that. And thanks to Dr. Corey, and always thanks to our wonderful producers, Miss Dorothy and Miss Christy, who do a fabulous job. Thanks to all of you for tuning in. But I think part of the discussion with Dr. Corey illustrates that one of the things we all have to do is good healthcare practices, regular checkups, blood work, because a lot of times leukemias and lymphomas are discovered in that way. And when you have a kid with blood cancer, as great as regular oncologists, hematologists are, even the great ones want to have the consultation and intervention of somebody trained in pediatric oncology. So thank you for tuning in. We will see you next Wednesday night on Battling and Beating Cancer.
Thank
Good night.
you. Good night.